We live in an era that I think is quite remarkable. There is growing awareness and appreciation of the prevalence and impact of mental illness. We take that on as a core mandate in everything that we do. The Department of Psychiatry at the University of Toronto is one of the largest departments of psychiatry in the world. We train at any one time almost 200 residents, 80 fellows from across the world, and we have a faculty of almost 900. We are big enough that we can be excellent in every area of psychiatry.
We receive about $110 million of external funding each year. About half of the funding comes from the Canadian federal government, and about 20% come from actually US funders, either the National Institute of Health or large US foundations. The Department of Psychiatry is organized in 8 divisions that encompass really the entire field of modern psychiatry.
The divisions are led by 1 or 2 directors who are supported to be leaders with regard to integration, mentorship, and joint programs in research and education across our multiple sites.
The Division of Child and Youth Mental Health here at the University of Toronto provides clinical care and services to children and youth through 9 academic and community sites, including hospitals as well as community children's mental health centers. The mandate of the division has shifted over the last several years to include youth and emerging adults, recognizing the gap in care for this population. We've worked actively with the government to improve the system of care for this age group. A recent example is the development of the Acute Care Alliance, which allows timely access to inpatient services for children and adolescents requiring inpatient admissions here in the City of Toronto.
The Division of Geriatric Psychiatry is very large, with more than 50 faculty members. The division is very strong in its research on behavioral disturbances associated with Alzheimer's disease, in late life mood disorder, and in translation neuroscience associated with aging and mental illness. With the aging of the population, the division has more than doubled over the past 10 years, and we expect that it will grow further during the next 10 years.
We recognize that as important as providing care is, it is important that we seek to understand the cause of illness so it brings us closer to both better care and potentially to cure.
The Brain and Therapeutics Division at the University of Toronto Department of Psychiatry is a very large department with over 200 faculty. The brain we study in many different ways, from imaging and clinical studies all the way down to molecular and DNA studies. Our genetics effort is looking at how genes are involved in the actual response of a patient to medication. We're actually delivering results on a panel of genes to the physician who's referred their patient because the patient's having some trouble with their antidepressant or antipsychotic treatment.
Our commitment to research is broad and deep, all the way from the cellular level to the community level.
We're changing the way our communities and our patients view and access our academic institutions by working in partnership in education, clinical program development, and research. We led this study that demonstrated that we can actually end homelessness related to mental illness or addiction, and we can do that at a very modest cost. The federal government committed $600 million over 5 years to end homelessness using this approach.
The University of Toronto has formed a partnership with 3 large hospitals in Toronto to create a new initiative we call the Medical Psychiatry Alliance, to really try to bridge the gap between medicine and psychiatry, focusing on the very common patient presenting with both physical and mental problems.
We are incredibly proud of the work that we are doing in global mental health. Our size and our resource base allows us to do things that are important at a global level.
We focus on training, capacity building, dealing with humanitarian issues, providing assistance following disasters, and in general trying to build better systems of mental health care. One of our flagship programs, the Toronto Addis Ababa academic collaboration, has been for the last 10 years training residents in psychiatry, and thereby increasing or quadrupling the number of psychiatrists in Ethiopia up to now.
We have one of the largest training programs in psychiatry in the world at the University of Toronto. We train between a quarter and a third of all Canadian psychiatrists.
We have an enormous program that spans the continuum from undergraduate right through to fellowship and continuing professional and practice development. Our undergrad program has a lot of unique offerings that are stimulating interest in our students in psychiatry, as well as preparing them to take care of individuals who have psychiatric illnesses, no matter what career they choose. Students are having the opportunity to shadow psychiatrists in the community, and we've also introduced an elective opportunity in therapeutic communication, which is extremely popular.
We are excited about the future. Psychiatry is a growth industry. The opportunities for alliances, collaborations that bring together the best minds in every part of health, I think bode very well for our future.
Governments and our funding agency realize that the brain is a new frontier. In terms of education, research, clinical service, I think the Department of Psychiatry will be doing even better than we are doing in 10 years.